Can depression be fatal? While the jury is out on this question, we now know for a fact that ketamine therapy for treating depression can surely lead to death. How can we be so confident about this? It's because Matthew Perry of Friends of Fame, found dead in his home in October of 2023, allegedly died due to the effects of ketamine, a drug used for treating depression. Watch this video till the end to understand how Perry died and also to know the ill effects of ketamine therapy. Matthew Perry shot into fame in the 90s with Friends, an American sitcom that chronicled the exploits of 6 young men and women living in New York. This sitcom was a great hit with the 20-something audience going through similar life experiences in their personal and professional lives. Perry's character, the sarcastic but real Chandler Bing, was the yuppie of the group, always correctly dressed, and perhaps the only one amongst the group with a white-collar job and his life very much together. But Perry's real life was never together. He struggled with drugs and alcohol almost all his life, spending more than half his life in rehab and treatment facilities in his own words. Perry never hid his addictions. He was rather public about his drug use, and he also wrote a memoir about it where he spoke about how he had been hospitalized several times for a range of ailments. On October 28, 2023, Perry was found dead in a hot tub in his house. He was just 54 years old. In the autopsy report, the cause of death was found to be related to the acute effects of ketamine. The police ruled out any foul play and called the death an accident. Just before his death, Perry had undergone ketamine therapy for depression, which has raised several red flags about this drug and therapy, and deservedly so. But before going any further, let us understand what is ketamine. What we know about ketamine is that it is a short-term anesthetic that is used as a treatment for depression that does not respond to other drugs. Ketamine therapy is also used for treating other mental health conditions. Ketamine causes hallucinations, and this leads the patients to feel detached from their pain. This is why ketamine is given to manage pain. In most cases, ketamine is prescribed to reduce pain after surgery and is usually given intravenously in hospitals. A specific type of ketamine, S-ketamine, has also been approved by the U.S. Food and Drug Administration, FDA, as a nasal spray for treatment-resistant depression in people over 18 years of age. Ketamine infusion therapy, as this therapy is called, is a relatively new treatment for certain mental health conditions, including treatment-resistant depression and post-traumatic stress disorder, PTSD. Only S-ketamine is approved for ketamine infusion therapy. But what is being seen is that people are abusing this dangerous substance to dissociate from their problems and experience a hallucinogenic state for getting relief from their mental health issues. Evidence suggests that Perry was one of such persons. According to reports, Perry's body had a high dose of ketamine. We do know that Perry was on ketamine infusion therapy for depression. We also know for a fact that he had undergone a ketamine infusion just 1.5 weeks before his death. But the high levels of ketamine found in his body were not because of this infusion, as ketamine disappears from the body within 4 hours. This proves that Perry was abusing ketamine. And it was this abuse that proved too costly for him. Perry had been living with substance misuse for years, but this time, his body caved under the collective pressure of high ketamine levels, coronary heart disease, drowning, and another drug called buprenorphine. Here are some signs that use of ketamine could be developing into a dependency. Compulsive urge to use the drug, neglecting family, work, and relationships, continued use of drug despite negative effects on health, needing to use higher quantities of the drug for similar effect, having painful physical and psychological withdrawal symptoms. Perry chose the wrong drug to abuse, as ketamine has been flagged as an extremely dangerous drug. According to experts, a ketamine overdose can cause extremely low breathing rates, heart problems, and loss of consciousness. There are several other known side effects too of ketamine, like dizziness, nausea, drowsiness, visual problems, vomiting, uneasiness, increased blood pressure and heart rate, and also confusion, amongst others. But this is just the tip of the iceberg. Recreational use of ketamine causes a large numbers of deaths, according to doctors. What happens here is that an addict buys ketamine for use, to get high or get rid of pain, like what Perry did, and usually ends up losing his life. Recreational ketamine can be used as a powder or liquid, and usually the addicts mix it with other dangerous drugs like ecstasy or MDMA, amphetamine, cocaine, and methamphetamine. This is when the shit hits the roof, as the effects of ketamine can be severe because of high dosages. High dosage of the drug can lead to heart attacks, as we have mentioned before, and it is also toxic to the respiratory system. No wonder Perry lost his life to cardiac arrest and low breathing, amongst other problems. He could have lost consciousness due to a dangerously slow breathing rate and heart malfunction, both of which a high dosage of recreational ketamine can cause. Perry's untimely death has raised massive concerns about ketamine therapy, even though he died from recreational ketamine drug use. Doctors say ketamine therapy is safe and effective, but only under the strict guidance of a doctor. Otherwise, it can be fatal, as Perry's death proves without a doubt. An unknown fact about ketamine is that it has been used as an anesthetic for more than 5 decades, at a much higher dosage than used for the treatment of depression, with no mishaps. In ketamine therapy, doctors give their patients small doses of ketamine over time. They don't give a large dose of this drug immediately, as it can be fatal. They also monitor the patient's vital stats like heart rate and breathing. For treating depression, doctors give ketamine in a controlled setting to cause a temporary mental state in which the patient detaches from his or her surroundings. The patient can have a psychosis-like experience where he can experience hallucinations and delusions, seeing or hearing things that are not really there, and this makes him feel better. Ketamine therapy is not given to everyone. Doctors check the patients both physically and mentally before starting them off on it, because this therapy can be more dangerous for certain patients, like those with a history of heart attacks, high blood pressure, or other heart problems. A doctor will not prescribe this therapy for these people. Doctors also take care to start with 2 sessions a week and keep reducing the frequency over time to avoid addiction to ketamine. In addition, doctors keep a watch on the patient's mental status during treatment and assess suicide risk during treatment, so there are no unwanted outcomes. What would have allowed Perry to live longer was to have continued his ketamine infusion therapy in a clinic under medical supervision. He had been getting this treatment done under medical supervision, and he was doing well. But still, due to Perry's death, the US FDA issued a warning about ketamine to clinics. His death has also attracted attention to how easily dangerous drugs like ketamine can be procured by anyone, as there is a lack of regulation and standardization around how it is sold. Matthew Perry's sad and unexpected accidental death has led a few drug companies to work on oral versions of ketamine for use at home to combat pain. Once they hit the markets, ketamine therapy for treatment-resistant depression will become safer and more accessible, and also lead to fewer unwanted side effects. Most of these oral ketamine therapy solutions will also use a prolonged release technique to make them foolproof, and they will also not give people a dissociative feeling that has made ketamine so popular among addicts. Perry lost his life because such a product was not available to him. He perhaps took a shortcut, procured ketamine, and misused it, and lost his life.